Dr. Jessica Shepard joins me now. She is the Chief Medical Officer at Verywell Health. Dr. Shepard, welcome. As we just heard, California is reopening. A majority of U.S. states have already reopened, yet just over half of the U.S. population has received at least one vaccine dose. Does our nation's vaccine rate concern you at all?
Well, we still have till July 4th until the president really wanted to get that 7% vaccination rate. Now, we are short of that number, but what we have seen over the recent few weeks is that the number of those people who are not going to get vaccinated and have chosen not to has stayed relatively the same. In a recent Verywell survey, it showed that 17% really didn't change their mind over the recent months about getting the vaccine. So what we need to focus on at this point are those who have received at least one dose of the vaccine. We still continue to encourage those people to get their second dose. And again, for those who have received the same dose, 2 doses of the vaccine rather, should continue to operate as they have before when the CDC made recommendations of not having to wear a mask both inside and outside.
So, 70% of adults in New York State have received at least one dose. President Biden, as you noted, wants the entire U.S. adult population to be at that point by July 4th. Do you actually see the country reaching that goal?
That is a question that day by day, as we continue to really look at the rates of which people are getting vaccinated, but also the constant messaging that we're using through the CDC, also with experts such as Dr. Fauci, and continuing to have a great ward of having people vaccinated, whether that's through incentivization, through jobs. We know that we're trying to reach those numbers. Now, again, that's the hope. Will we reach those numbers? That's soon to be seen as we're approaching July. But with California having a grand reopening, we know that people are more likely now to discontinue social distancing. And again, unvaccinated people versus vaccinated people being in the same space, that really is going to be the telltale sign of motivation towards getting vaccinated, but also looking at rates of COVID infections, if those will have an increase among those that are unvaccinated.
Well, the COVID death toll has surpassed 600,000 in the U.S. Could we see cases and deaths rise as more states open up?
This is, again, something that rests solely on the amount of people who continue to get vaccinated. And again, as we start to see variants, now we know of the variant, the Delta variant that we've seen rise out of India, has again been the proponent of most of the recent COVID infections that we have. But again, looking as states start to reopen, we know that in California, even Disneyland has opened, which is going to attract more tourists. And again, having people who are in a very large amount of congregating among unvaccinated and vaccinated, this we'll see science work and the ability for us to possibly decrease the risk of infection, but more importantly, among those that are vaccinated, having the protection against having a COVID disease.
Now, the vaccines are not 100% effective, so there are some breakthrough infections, meaning people who've been infected with COVID after being fully vaccinated. But, Doctor, how often does that happen?
Now, when we look at people who actually have the disease after a full vaccination, we know those numbers are very low. Now, when we look at the CDC study of the 2,400 people in the study that had coronavirus, only 3 had confirmed coronavirus infections after receiving the full vaccination course. Now, as recent as April 26, 2021, this year, only 835 resulted in hospitalization. That's relatively low when we look at an overall number of 95 million Americans who have received vaccination at that time in April. What we do know is if there are any infections with coronavirus after being vaccinated, that can be a risk of having imperfect vaccination administration.
All right. Well, Dr. Jessica Shepard, thank you very much.